Good afternoon, chairpersons, faculty members, and dear students. My topic is specimen collection in microbiology, emphasis on mycobacteriology. Introduction. Tuberculosis is a serious re-emerging infectious disease caused by Mycobacterium tuberculosis complex. It can be pulmonary or extrapulmonary. Need for the proper collection guidelines. The quality of a result is directly related to the quality of specimen being cultured. The best results are obtained only when the appropriate guidelines are followed. Safety consideration. Treat all specimens as potentially hazardous. Use appropriate barrier protection like gloves, mask, gown, protective eyewears, and aprons when collecting or handling the samples. Do not contaminate the external surface of the collection container or the accompanying paperwork. Minimize direct handling of the specimen in transit. Use plastic sealable bags with a separate pouch for the paperwork. General guidelines for the specimen collections are: collect specimen with a little contamination from the indigenous flora as possible. Clearly label the specimen container with the patient's name, ID number, and date of collection, time of collection, and specimen source. Collect an adequate amount of specimen. Inadequate amount of specimen may yield false negative results. Container need to be opened and closed properly without touching inside of the container or the cap. Mention the specimen source or specific site correctly. Transport all the specimen to the laboratory promptly. Container which we use for the sample collection should be strong, unbreakable, leak-proof, screw-capped with a water-tight seal, clean or sterile, 50 ml with a 50 ml capacity, translucent or clear material, easily labeled wall. 50 ml conical tubes, that is falcon tubes, are ideal and can be used for processing also. What are the pulmonary samples? Pulmonary samples can be sputum, bronchoalveolar lavage, gastric aspirate in children's, ET aspirate, endobronchial ultrasound guided transbronchial needle aspiration, and lung biopsy. Extrapulmonary sample depends on the site of the infection. Like if there is a urogenital TB, then the urine sample, menstrual blood, uterine biopsy sample can be taken. If there is a lymph node infection, then lymph node aspirate. Body fluids like pleural fluid, ascitic fluid, pericardial fluids can be taken. Synovial fluid. If suspecting for the tubercular meningitis, then CSF has to be taken. Pus sample has been taken for the tuberculosis as well as for the atypical mycobacterium. Tissue or skin biopsy can be taken. Endoscopic intestinal biopsy samples are taken for the suspicion of the abdominal tuberculosis. Sputum sample. Sputum samples are recommended. Two samples are recommended. First is the spot sample that is collected on the same day under the supervision. And second sample should be collected early morning on the next day. Sputum collection booth should be located away from the other people as dilutes the aerosol generated during cough. अगर कोई कलेक्शन का बूथ नहीं है तो दीवार की तरफ फेस करके भी स्प्यूटम कलेक्ट कर सकते हैं. पेशेंट जो है और जो अटेंडेंट है he should wear mask and proper protection. Sputum should be at least 3 to 5 ml in quantity, thick and purulent. Specimen from the sterile sites like pleural fluid, it should be considered a suboptimal specimen as tubercular bacilli are mainly in the pleural wall and not within the fluid. The minimum volume for the pleural fluid required for the processing the culture is 20 to 50 ml. The fluid is collected using the pleural tap or thoracocentesis. Cerebrospinal fluid, that is CSF, 6 ml of CSF should be collected for the adult and 2 to 3 ml of CSF for the children by the clinician under the aseptic condition. Pericardial fluid or ascitic fluid should be collected guided by the ultrasonogram by the clinicians. Biopsy from the different sites. Excisional biopsy is preferred over the incisional biopsy, as excisional biopsy has the highest diagnostic yield, and incisional biopsy later may be associated with the sinus tract formation. Mediastinal lymph node biopsy is done with the help of bronchoscopy, mediastinoscopy, or EBUS. Tissue. The aseptically collected tissue are dispensed by the physician in a sterile container without fixative or preservative. This is the very important thing कि कभी हमारे लैब में फॉर्मेलिन फिक्स होके भी आता है तो वो प्रोसेस नहीं होता है. हमारी लैब में जितने भी सैंपल और स्पेसिमेन आते हैं वो सब या तो फिक्सेटिव या प्रिजर्वेटिव के विदाउट होंगे या नॉर्मल सलाइन में आप भेज सकते हैं. Specimen from the non-sterile sites. Urine specimen. To minimize contamination of the urine specimen, instructions to be given to patient for collecting the urine with adequate cleaning of the external genitalia to prevent the contamination by the commensal. Whole early morning sample. बैक्टीरियल अगर हम बैक्टीरियल के लिए सस्पेक्ट करते हैं अदर तो हम मिड स्ट्रीम यूरिन को एडवाइस करते हैं, बट टीबी के लिए ट्यूबरक्लोसिस के लिए हमें अर्ली मॉर्निंग फुल पूरा सैंपल पेशेंट को बोलना होता है कि पूरा सैंपल हमें लेके देना है उनको. As excretion of the tubercular bacilli in the urine is intermittent, consecutive 3 early morning specimen must be collected. It is collected in a 500 ml screw capped sterile bottle. अगर पेशेंट के पास नहीं है स्टेराइल बॉटल तो वो अपने घर से यूज कर सकता है कोई 500 ml की बॉटल, बट वो क्लीन होनी चाहिए. Swabs are always suboptimal specimen and not recommended. Sterile absorbent swab, cotton swab should be used for the collection. Bronchoalveolar lavage, it should have a minimum volume of 20 to 50 ml. And bronchial aspiration is for 2 to 5 ml. These are the culture media we use in the lab for the culture process. This small bottle is used for the routine culture media. It is a LJ bottle, Lowenstein Jensen media, and this is the second is the Bacteria alert bottle. Specimen storage. All extrapulmonary samples need to be transported to the lab and processed immediately. In case of any delay, the specimen must be stored at 2 to 8 degrees centigrade. The laboratory must be informed as soon as the specimen is collected. जैसे ही आप specimen collect करते हो तो आप कोई भी resident है या जो भी है अगर possible है तो lab में आप बता दें कि ये important sample है, हमारा जल्दी से जल्दी process हो जाए. Transportation. Material required for the sample collection, packaging, and transport are to made available. Courier speed post should be identified. In Uttar Pradesh, there is a MOU with the Indian Postal Department for the transportation of samples to the NAT and CDCT ST labs. Fresh samples transport to the lab as earliest in the cold chain. And there should be a triple layer packaging. Material which are required for the triple layer packaging is a 50 ml conical bottom polypropylene tube, or that is the primary container we can use a tube. If it is not present, then polythene bags or the Ziploc bags can be used. It can be used as a secondary containers. Thermocol box, tertiary container. Form should be there. Request for the testing of biological sample. Ice gel pack. Tissue paper, absorbent cotton, parafilm tapes, brown tape for the packaging box, permanent marker pen, label and biohazard stickers, scissor, sprit, and swabs. These are the steps for the sample packaging. The step 1 is to make sure that the specimen collection tube is tightly closed after the sample has been collected from the patient. Second step is to wipe the outer surface of the 50 ml conical tube with 5% phenol followed by absorbent tissue and allow it to air dry. Third step is to write the patient detail on the opaque area. of the specimen collection tube using a permanent marker pen clearly in the capital letter. Then cut the parafilm strip. Wrap one of the strip at the joint between the cap and the neck of the specimen collection tube such that a secure seal is formed. Then open the absorbent cotton roll and spread out on the workbench. Separate the cotton into a 2 equal layer. Roll the specimen collection tube containing the sample tightly in the absorbent cotton such that the tube is covered completely. सारा जो है साथ में पिक्चर्स भी उसके बने हुए हैं आपके समझने के लिए. Then put this roll containing the specimen collection tube into the Ziploc pouch. Roll the whole into a tight bundle, ensuring that there is no air in the pouch. This bundle should be secured with the rubber bands. Next is to repeat step 5 to 7 for the second sample. Like आपके पास एक ही sample नहीं होगा, बहुत सारे sample होंगे, तो उन सब के लिए same process करना है. Insert the test request form printed from the Mishra into the Ziploc pouch after ensuring that the detail on the form and the sample tubes match and the writing faces outside. That is, the detail of the patient should be visible through the package. Then seal the Ziploc on the pouch and place the cool gel pack in the thermocol box, and then it is transported.